So if everybody's settled, so we will start. Welcome back to the plenary. After a long day, we will have the final session, but it will be, I think, fun. So welcome, and it's really my very great pleasure to introduce today to you the initiatives of several of our member organizations. They are really amazing, and they have all qualified for the Advocacy in Action Award of SPAGN. The award was established in 2017, and SPAGN actually created the award to be able to honor these many wonderful initiatives of the member organizations. We have now, as you have heard, we have now 68 member organizations, and I'm sure all of them have really great projects and stories to tell. Actually, in my capacity as a member of the blog team, I had the chance to meet some of them, and it's really enlightening and sometimes humbling also to see what patients, parents, caregivers, and patient advocacy representatives are pulling off the ground to help improve the quality of life of sarcoma patients. So, unfortunately, not all of them can be supported, although, of course, they would merit it. Only few can get the selected, can receive the award. And the award is, of course, a great opportunity to mobilize some small, modest funding. That's true. But it is also, of course, and more importantly, I think, a recognition of their work and an opportunity to showcase their projects to a larger community. Now, coming to the process of this year's award, in October 2023, SPAGN announced or called for the submission of projects looking for sarcoma-specific projects of patient advocacy, either ongoing or completed, in the fields of patient information, education and training, improving quality of life, social media and digital communication, generating real-world evidence, advocacy and lobbying the healthcare system, and being involved or driving sarcoma research. Those were the categories, and deadline was 31st March. We received 16 applications, and all of them with wonderful projects and stories. Now, 2 from the US, 2 from India, and 12 from Europe. I would say there is a need for diversification, maybe for the next year. A jury composed of patient advocates and healthcare professionals actually assessed the submissions, and they looked particularly at aspects like impact, patients reached, the potential for adaptability and replicability, sustainability, costs and funding already mobilized, and the grade of innovation. So, we have now here 6 finalists, and they're from different fields of the mentioned ones. 3 are in information, 1 in training, 1 in research, and 1 is a funding initiative. So, the information projects are, for example, about accessible patient information in a simple and understandable way in a booklet in local language. Then, on the other hand, we have another project to provide sarcoma information on social media, but verified by experts. There is also a guide for follow-up care for patients and families after the end of treatment. Then we have a training project, a psycho-oncological training project for various people who help cancer patients. There's a collaborative funding initiative and a patient registry to collect and analyze patient experiences and create real-world data, as we have heard about that one. So, the representatives of these finalists will now explain to you their projects. Each has 7 minutes, followed by 2 to 3 minutes for questions to clarify. And after the presentations, that is about in 1 hour, we will announce the winners of the first, second, and third prize. and hand over the certificates, yeah. So I invite now the following speakers, one by one. So the first one will be Jyoti Patil Shah from WeCare in Mumbai, India. A big applause.
Okay, the mic, yeah. Thank you. WeCare has been in the space of cancer care for the last 30 years, and the information booklets have been one of our core projects since the beginning. They basically provide, we have a lot of titles, more than 36 titles. They cover all cancers, and the special part of these information booklets are the psychosocial topics that we have. Most of these booklets are given to the hospitals or to the patients on a pro bono basis. So we donate these booklets to the various centers that we reach out to. Initially, when Vandana had started WeCare, these were handwritten notes. They would write down the notes, and all these booklets have been incorporated with the help of a physician, a healthcare provider from the hospital who has guided us to get these booklets, the notes written in a very simple and basic language that the patient can understand. The challenge came when Vandana herself was undergoing treatment and she wanted to understand what the doctor was saying. I think from there the thought forward came, how do we explain it to the patient in a very basic, simple terms? So we had the handwritten notes, then we had printed information sheets which were in 3 folds. Then somebody, a farmer was kind enough to have it in colored booklets, which we continued for some time. And now currently we have them in single color. This is all because of the cost that was coming to us for the booklets. We have the booklets majorly in English and Hindi, but we have it in few of the regional languages, not all topics, but very few of them. Like Marathi, Bengali, and very recently, because we were a hospital in north of India had requested us for a regional language there, so we got them translated in Gurmukhi. In the last 5 years, we have roundabout reached out around 796,000 patients with these information booklets. We are in the 6 states hospital. There are around, these booklets, as I said, whenever they have requested, we have donated these booklets free of cost to these hospitals. Most of them are regional cancer centers where we have patients who come from the low middle income category. Though there are people, we have these on our websites listed, we have the soft copies, but there are still certain sector of people who are not very friendly with the soft copies of the booklets, and hence the printed literature is what they look out for. And these are some things where maybe every time our patient advocate is not able to be there, but these booklets are somewhere they can take back home, sit back, relax, and read these booklets whenever they have the time. Maybe certain times they read the booklets and come back to the doctors, asking for more information. And as I informed that these booklets have been created along with our doctors. They have helped us make this booklet in a very, very simple language. A few of our psychosocial booklets, which we have not yet translated into the regional language, and many of our patients who come from the eastern part of India, that's the West Bengal, and so their regional language is something that we have not yet touched upon, and which we are looking forward to getting these booklets translated in those languages. So this is the very little gist of what our information booklets are about, and we are looking forward to getting it more of these titles to be translated, and more patients that we can reach out to. Thank you.
So are there any questions for Jyoti? None. Okay, then I would like to invite Maria Brandt from the German Sarcoma Foundation.
She said I should do it fast, and now. Yeah, so my name is Maria Brandt from the German Sarcoma Foundation, and we started the strategy on expert-verified sarcoma knowledge on social media. We started in 2023 with that strategy because I think everyone can relate to that there is a very poor situation for those who are affected, because there are a lot of wrong informations about sarcoma circling around and the internet, and we wanted to create something against that. There are also many doctors or health professionals who do not know about sarcoma, so we also wanted to address that problem. And we also figured out that there are a lot of students who study medicine who never heard in their time in university about sarcoma, so we also identified them as a target group. We started with our Instagram channel, and before we started, we did a lot of research. We really got into what are the problems we need to address when we create relevant content on social media. And that's the key point for us to. You cannot go on Instagram or any other social media platform and just create content. It must be relevant, otherwise the algorithm will not support you. And we wanted to reach the goal that the algorithm identifies the target group for us on those platforms, so it makes it easier for us to reach our target group. Like I said, our target group was not just patients, it is healthcare professionals. And what we did, we started to create relevant but snackable content. We call it snackable content because it must be very easy for them to snack. So we started to produce a lot of short videos with sarcoma experts. Every German sarcoma expert who is in the room knows me, because whenever they are at a sarcoma conference, I run after them and I ask them to participate in our videos. We also address research topics. We have created categories about news from research. Michi, you give me the cut when I'm too long. We have news from the sarcoma centers. We created for each category their own colors, so people recognize it very fastly, like what category we are posting right now. We have put a lot of effort in our channel promise, so the algorithm knows what the user has to expect. And I can say in November 23, we did a review for the last 90 days, and at that point we had around 2,000 followers on Instagram, but we reached 23,000 accounts. That means the algorithm already identified for us 20,000 other accounts for whom our content is relevant. And our views at that point our posts were viewed 200,000 times. So that is a large number. It means that every account that we reached, at least, I think, around 10 times they read our postings, or 10 of our posts. I did the last review in April, and we reached over 46,000 accounts, and our posts were viewed 390,000 times. But most importantly, not the numbers, but the feedback we have from our community. We got a lot of thank you notes from our followers, not just patients, but also health professionals. They are already writing us like, when is the next post, and can we do this topic? We are now at the point where we do cooperations with other health care organizations, and I would love to share also another proof of what social media can do. And it's pretty hard to do this slide now, because in December last year, our dear colleague Lena, who was also part of the social media team, died, of course, due to a sarcoma. Maybe some of you know her because she also worked for SPAGN sometimes. And before she died, she left a note with places she wanted to visit and to see in the world. Prague, Vienna, Venice, Madrid, Milano, and she couldn't obviously anymore. So right now, while I'm speaking, her father Heiko is on a tour, on a bicycle tour across Europe, to visit all those places in her name and to raise awareness for sarcoma. And we posted about this on our channel, and it immediately was reposted by thousands of people. Right now there's a German television team on their way to follow him on his trip. And I think we had, for the first video, 70,000 views on it. And I think it shows what we can do with social media if we use it in the right way. And I think this is also something that cries for SPAGN help and support. So if you can support this fundraising tour across Europe, this raising awareness tour across Europe, I would love that you share it on your social media accounts. He is right now in Austria. He is in the next days crossing the border to Italy. He will be in Milano. He will come to Madrid. So if you, I don't know, want to meet him or support him, you can contact me. And I hope we can, or I do not hope, I know we can achieve great things under this hashtag. Thank you very much.
Thank you, Maria. So now I have to check. Sorry, Kathleen Kane from the Bone Cancer Research Trust and the Sheffield University.
Hello. Ooh, you're in the microphone. Hi, everybody. Can you hear me okay? Yeah. Maybe this one's better. Yeah, that's much better. Hi, everyone. Yes, my name's Kathleen. I'm from the Bone Cancer Research Trust in the UK. For those of you who don't know us, we are a medical research charity. We fund vital research into primary bone cancer or bone sarcomas. And we also provide a wide range of information and support to the primary bone cancer community, as well as raising awareness of primary bone cancer amongst the general public and also healthcare professionals. So we're very grateful to have the opportunity to share this project with you today. It's really hard to follow such inspiring projects. But yes, the project we'd like to share is a collaboration between the Bone Cancer Research Trust and students at the University of Sheffield in the UK. So as part of our awareness activities, we work very closely with the University of Sheffield, hosting medical students on placements which focus on both research and social accountability. So together we are currently developing Your Guide to Follow-Up Care, which is a survivorship-focused resource for the primary bone cancer community. So our latest organisational strategy sets out our commitment to ensuring that more patients are able to not only survive their diagnosis, but also to thrive beyond it, recognising the long-lasting physical and psychosocial impact of treatment, and kind of placing a renewed focus on quality of life. So since 2022, BCRT and medical students from Sheffield have been working closely with our community, gathering their experiences of the longer term and late effects that they experience in the months and years beyond treatment, really with the aim of better understanding the support needs that they encounter throughout their survivorship journey. So these initial consultations highlighted a real breadth of physical and psychosocial long-term and late effects, coupled with an uncoordinated patchwork of follow-up care, limited access to late effects clinics, and limited information generally as patients are trying to navigate that transition from patient to survivor. And when we asked participants how they would like these discussions to be taken forward, they were very clear that they felt BCRT could in some way bridge the gap that they had identified in information and support. So in December last year, our latest cohort of medical students set out to do just this, and they developed a proposal for a new resource which aims to support patients, but also parents and carers as they navigate life beyond their primary bone cancer treatment, providing them with evidence-based information and practical advice which is shaped by lived experiences on what to expect throughout their survivorship journey and key considerations as they go through follow-up care. So early development involved multiple stages of evidence gathering and consultations with our patient and public involvement panel, as well as healthcare professionals, with a focus on being guided by the patient voice and patient identified needs. We did face several challenges from the outset, so we know that follow-up information and support can very much vary depending on where patients receive their care, and we wanted to make sure that the resource was able to support and align with what is available for them, helping to bridge any gaps, but also making sure that it shaped realistic expectations for their survivorship care. And another key challenge was, of course, the huge diversity of patient survivorship experiences in terms of lots of different primary bone cancer subtypes, treatments, age groups, socio-demographics. But in terms of key learnings, as we kind of went along with the process, the students were able to address these challenges by involving the patient voice at the earliest opportunity, adopting a co-design style approach, which allowed members of our community to really be able to voice their needs and to be able to have a truly active role in shaping this resource proposal and helping to take it forward, whilst also being supported by the perspectives of healthcare professionals and their own experiences of delivering survivorship care. And through this approach, students were also able to get an understanding of expectations on both sides of the patient-healthcare professional relationship, which was really important. And collectively, they advocated for a thematic approach. So the resource offers wide-reaching support across 5 key themes, which are highlighted in the blue box. And the idea was that these would be common to different primary bone cancer journeys. So the proposed resource will now undergo a full information production process in line with requirements for accreditation by the Patient Information Forum, which is a kind of quality assessment standard. And this will involve ongoing consultation with our community and with healthcare professionals. And together we really hope to develop something that is able to inform, support and empower patients and their families throughout their survivorship journeys. So just finally, we'd like to acknowledge the incredible hard work and dedication of the medical students who've been working with us and who are really committed to staying involved with this as we go on to develop the final resource. So we have here Sam, Elora, Isabel, Emily, Scarlett, Phoebe and Ria. So a big thank you to them and thank you very much for listening.
Thank you, Kathleen. And now you have heard 3 projects related to patient information. And I would now like to call Kamil Dolecki from the Polish Sarcoma and Melanoma Patients Association and Institute of Mother and Child.
Greetings, everyone. I would like to briefly present the High Five project. With the High Five, our goals was to increase knowledge about pediatric oncology among nurses, volunteers, teachers, and psychologists. All of them work with young cancer patients and sometimes find themselves without the tools to help children in need. We created a series of trainings were members of the Sarcoma Association and specialists of the Institute of Mother and Child shared the knowledge about understanding the treatment process, the psychosocial impact of the disease, and effective mental support strategies for patients and their families. The project also includes lectures for young people whose friends are fighting cancer. All of trainings lectures were accredited by the Polish Psycho-Oncological Association. Hashtag High Five has been well received by the participants, and we would like to continue giving high fives to those who want to help the others. Thank you, and I'm sorry for my English.
Thank you, Kamil. And I will now invite Ms. Zoe Davison from the Bone Cancer Research Trust and UK Sarcoma.
Hi everyone, thank you for giving us the opportunity to talk to you about a project that we're doing with Sarcoma UK. So Bone Cancer Research Trust and Sarcoma UK are both charities based in the UK, and we're really proud to be working together on an early diagnosis project. So ever since the charities were established, we've been collecting anecdotal evidence that diagnosis for our patients is really a problem. It takes far too long. Patients have to go through different healthcare professionals, lots of problems. And back in around 2020, both charities reached out to their patient stakeholders and supporters to try and get a bit more concrete evidence. So we ran patient surveys and stakeholder meetings and interviews, and we engaged with about over 1,500 patients and healthcare professionals to really start to build some evidence. And what we found is quite scary, really. So 1 in 3 patients wait at least 6 months to receive an accurate diagnosis of sarcoma. And on average, bone sarcoma patients visit healthcare professionals 8 times before receiving a diagnosis. And this is really a problem. And I go back to one quote that we had from one of our patients, which I find really haunting, is that she found the time taken to get a diagnosis that exhausting. She really didn't have any fight left to go through her treatment. And we can't be continuing in that way. We need to do something about this. We also went to our supporters to see how they want us to tackle early diagnosis. To date, we've done education programs, awareness campaigns, but we got a really clear message that our supporters, our patients, wanted us to look at this from a research point of view as well. So that's what we wanted to do. So we started to have a look about how we might address this challenge through research, and what we did first was we wanted to know what research had been done in this space. Research into detection, early diagnosis in cancer has received much less attention than developing new drugs. And actually, when we looked at it, there was pretty much nothing there. There's not much done in the area of sarcoma in the research space. So we needed to get our community together. We couldn't just put money towards it. We needed to get the community together. We need to understand what the priorities were, what the gaps were, where we really could make the biggest difference. So we decided that we would hold a research meeting. So we invited healthcare professionals, researchers, and patient advocates to come and attend a meeting where we would hash out all of these issues. So in January of this year, we held a meeting, and it was attended by over 70 experts. researchers and patient advocates. And we had some presentations where we heard about updates, about promising things that might be happening in other cancers, but we also had some roundtable discussions where we could talk as a community about what might work in sarcoma. Sarcomas are really hard to diagnose. They can happen anywhere in the body. What was going to make a difference? So out of this meeting, we identified key areas and key themes, which were how could sarcoma be diagnosed more quickly, more accurately using biomarkers? How could people at an increased risk of having a sarcoma be identified, stratified, but then monitored? Will that make a difference to diagnosis? How can healthcare systems be optimized to improve sarcoma diagnosis? And how can data, technology, and artificial intelligence be used to improve diagnosis and early detection? So we're really, really pleased to say that we now have a funding call open. Now we have explored that area and we've got some initial ideas. So it's very much being shaped by our community, by our patients, and we're hoping that this will really drive a positive change and we will get some projects that are going to make a difference in this area. So we have a total budget of 500,000. Projects for all types of sarcomas and for bone sarcomas only, and we can accept small grants, so 100,000, or large grants, maximum £250,000, and the deadline is the 20th of June this year. So if you want more information about those funding opportunities, you can reach out to either of the charities or here or via our email addresses. Thank you.
Thank you, Zoe. And before I call the final speaker, I need to admit that I have violated my own protocol that I have established. That is, I said, like, after each presenter, there would be room for questions. I just ignored that. No? So I just want to announce that I will ask for questions after the final presentation. So please, Sydney Stern, on behalf of the TGCT Support LifeRaft Group.
Hi, so my name is Sydney Stern. I have been part of TGCT support since inception. Some may say it's synonymous with my name, so if you've heard TGCT support, you may have heard my name at the same time. And so I wanted to go over some lessons learned. And since I'm so incorporated in this organization, it's hard to separate the fact that my story is part of it. So I am a scientist at heart, but I'm a patient, and those are deeply entwined with each other. And so in 2019, LifeRaft Group is an organization that joined the TGCT Facebook groups, and they asked a single question: would you change your diet to make medication more effective? And I answered, this very technical answer. I'm a scientist, so I was like, well, it depends on the absorption of the drug, and you have the pharmacokinetics, and it depends. And they're like, who are you? Deeply, we have no idea who you are. And so Sydney, LifeRaft Group, and the entire TGCT community developed this program called TGCT Support in 2019. What's different about me is I can't not be a scientist. So I was really inspired by LifeRaft Group's motto, patient-powered research, and I consolidated that information. I was like, okay, this is where I would do best, right? I'm a scientist, I make medical data, real-world data is my jam. So how can I do this? So I made the TGCT support registry in 2020 of September. As you can see, it's pretty simple. It's based off of REDCap, which is a very common medical survey we use in the United States as well as globally. So it captures very structured information. What I found in these lovely support groups is it's enriched with amazing experiences that should be leveraged. But what's missing is that they're unstructured. There's no cohesion, there's no themes, there's no scientist. So I filled that slot through making it a very structured experience. And so my objective was to honor patients' lived experiences while fulfilling the requirements of real-world evidence that benefits patients directly. Unlike sarcoma and some of the other spaces, that data didn't exist. How patients felt over 10 years didn't exist. Survivorship isn't a word we use. And so I wanted to add structure to a very unstructured world. and create a quantitative natural history with structured questions that engage patients at all stages of their disease from immediate diagnosis on 10, 20 years. And as you can see, I made this presentation on a train, so you can see some of my things are kind of off a little bit, so you'll have to excuse that. But what we developed was a registry with more than 900 patients in less than 2 years. Many of the patients entered the registry before their first treatment, 1/3 even. 1/4 of all of those patients are on medications, and nearly half are non-US patients, which has never been done. We did this collaborative effort, and this is all patient-powered. It's all inspired by this concept from the LifeRaft group, which is that we are able to generate this data with the right tools, we'll say. So some of the challenges we encountered was that the validated questions that only kind of existed at the time left really little to be desired from a patient perspective. Whether I can mow my yard or do laundry did not matter because I don't mow my yard now. So purely after treatment, it's not going to make a difference. So these questions didn't get at the heart of the experience of the disease. There's also global differences in the nomenclature itself. Whether race and ethnicity is, how we catalog it in the United States is different than the United Kingdom. And so how do we capture that information that's representative of everybody? We also wanted to demonstrate a global need, but had to consider the influences of just healthcare systems. Whether someone gets a repeat exam may be different based off just country alone. And it looks like it got cut off, but continued to engage with patient populations that allow the information to grow like the patients do. That's real time, that really encapsulates every experience that's happening within the disease. But patients had to feel personally responsible to the success of this registry. We all have taken surveys and we never answer again if they ask. So how do we keep that sustainability of the survey? And I will say we have a 93% response rate in 2 years, so everyone answers, and that's because patients feel deeply responsible for the success of this. And so the last challenge is how do we disseminate that information in a way that really honors patients, that doesn't just let them know the end point, that lets them know throughout the whole process, and exemplifies what transparency, but scientific rigor means. So some of my best practices is to keep patients at the forefront. I feel like if that is the guiding light to everything, we will do no wrong. The questions that we ask in our registry is a mix of validated questions and questions that really matter to patients. So we can intermix that in a report that has the scientific rigor needed for publication, but also really captures the information important to patients. We can slip it in. So what's important to patients may not always be obvious. Like I said, I don't mow the yard. It does not make a difference if I suddenly start, and that doesn't capture my experience. So how do we capture the experience of patients in a way that really benefits them so we can publish and disseminate that information that may benefit insurance claims, practice in actual medicine, or just validating the actual experience of being a patient? And so this is through, and you've probably all said this yourself, engaging patients early in the design. We had a pilot survey. We took patients from our support groups and we said, can you please answer this? Just for me, tell me what you think. If it's crap, please tell me. And we just kept doing that, an iterative process until we got a survey that now has over 900 people in it. And we're about to publish and go to CTOS. So you will see it again with the data. And so continued engagement is crucial for the success of this. Some of the patients in this room know I've hit them up over and over again. Can you make sure you finish it? Oh, okay, great. Oh, you finished it? Do you need any help with it? So continuing checking in, making sure they feel a part of the process, and to use those validated questions with a mix of structured, non-structured questions to allow them to maybe point things out you wouldn't think of. And then just the scientist in me, think of statistics before you make a survey. What a survey is capable of doing is based off the statistical plan, and so you have to do that early, and you have to recheck in with that often. So I want to say thank you. I want to acknowledge patients with TGCT, right? You guys are the reason we're here, many times the reason I'm here. Their caretakers cannot be forgotten. My fiance, Zach, who puts up with me. LifeRaft Group for continuing to give me the opportunity. SPAGN for inviting me constantly, even though I bother them to no end. And a special thank you to a patient. I made this on a train, and I sent it actually to a patient who made it look pretty. So thank you, everybody.
So thank you all for sharing these awesome projects. And I would like now to turn to the audience and invite you to ask your questions. Maybe you found something interesting, you want to pick the brains of the colleagues, or you have some need for clarification. Anybody? No. So, then...
I have a question.
Oh.
As pathologist, normally I, in most cases, do not have a direct contact to the patients. So I have really a lot of interesting cases in my department, but can I then just write a letter to the patient and say, hello, I'm your pathologist, could you give me some more information? This is in Germany really a problem that normally the patients have to be asked by a clinician or by somebody else whether they want to be part of a study or of a survey or whatever. And I think it's really problematic because we have the tissue is the issue, and we cannot do something with follow-up or all these important questions, side effects, whatever, response, because we do not have the direct contact. And it's especially in reference pathology, you get cases from all over Germany, so I cannot write to the pathologist at the local place, please could you bring in a broad consent of the patient. So what can I do with that? Any advice?
I can try as the US patient here. What I would recommend in knowing some of the laws, you'll have to correct me and please step in if you want, is to the prescribing physician, I would contact them directly and see if you could share that information. So get consent from the prescribing physician on there. Email them. I mean, I email all of these German doctors repeatedly. So that would be my recommendation. I don't know if Casper also...
Yeah, but prescribing physicians, you know, they are not my contact person. The contact person normally is the other pathologist, and he's as separated perhaps from the prescribing doctor. It's just a matter of data insurance or whatever, however, data protection that we are suffering of, that we cannot just address patients personally. Perhaps we should, I don't know.
Catherine, I don't know if I would also say contact an advocacy organization and say, I have a patient I'd really like to contact. Do you know the doctor? And have that organization maybe be the loop.
This is already forbidden. I cannot take the report and just, you know.
No, not send the report. Just contact them and say, do you know this doctor? Are you allowed? Okay. Maybe. I don't know. Yes, please, save me.
Maybe, I don't know. I know in the Netherlands, some hospitals, of which the cancer hospital as well, they use informed consent at the door. So once a patient enters the hospital, they are asked once if anyone can use anything that they leave there. And also the biobank is also part of it. So eventually you would love for all hospitals to have that. But that would also a logistical problem, probably.
Yeah, it's true. We have, of course, these cancer centers, which also have broad consent. Our own hospital has that also. But the majority of cases I get are not from these big hospitals having the broad consent, but rather from small pathology practices. So they need it too, of course. I mean, she should always have a consent of the patient. I mean, I have to admit, all you're sitting here, I would suppose that in 80% of cases you don't know your pathologist, might be even 90%. And this is the first problem, I think, that nobody, on one hand, acknowledge what pathologists do. They just don't sit around and get the day away. And the other thing is, to get more information, because especially in reference cases, it's so important to get more information, and normally we get to just get the block, and then it's from the stomach, and that's it. Oh. Okay. No solution yet.
Somebody else with a question? Okay, so then I would like to invite a member of the SPAGN board to announce this year's winners of the Advocacy in Action Award, Dr. Ornella Gonzato. She's the member of the board, and she's also the founder and president of the Paola Gonzato Rete Sarcoma organization. And she has also last year very generously supported the awards. And I would like to invite now Ornella. She has another announcement to make before she moves on to announce the winners. Thank you.
Thank you, Gabi. It's my honor to announce the winner. But as you mentioned, last year I sponsored the SPAGN award as a sign of my support and gratitude to SPAGN for its effort in building an ever stronger disease community, providing us all the feeling of belonging to a common global home. So this year, I've decided to sponsor a new upcoming award, always under SPAGN's umbrella, a single prize of 3,000 euros for the best advocacy project on bone sarcomas, with the aim to further stimulate the bone sarcoma community. As several of you will remember, during last SPAGN annual conference in Dublin, I announced the setting up of the Bone Sarcoma Alliance, whose aim is that of bringing together the different communities focused on a specific type of bone sarcoma to work conjointly on issues of common concern in order to amplify the voice of all bone sarcoma patients. So this SPAGN Bone Sarcoma Award 2025 will be in memory of my sister Paola and as a part of my commitment in serving this community. And now it's my pleasure to announce the winners of this SPAGN Award edition. I'm delighted to award the 4 ex-aequo winners in the first position. They are Booker from India, yes. Germany Sarcoma Foundation. Polish Sarcoma and Melanoma Patients Association and Institute of Mother and Child. And Bone Sarcoma Research Trust in cooperation with Sheffield University. Well, and now 2 competitors are remaining. Bone Cancer Research Trust and UK Sarcoma and TGCT Support and Life Raft Group. And the winner of the SPAGN Award 2024 is the TCT Support and Life Raft Group. Grazie. And of course, congratulations for the second fabulous position to the Bone Cancer Research Trust and Sarcoma UK. Well, thank you very much. Thank you all.
Thank you very much. Maybe you want to do a group photo with all of them. And just hold on a second until we're done with this. Great. Thank you. Thank you, all the presenters. Thank you to Ornella. Thank you to the audience. And I look forward to seeing you at the dinner.